Could you all hear me before? So only a couple of weeks ago, the OECD produced one of its regular reports. I think this was the third report it's done on New Zealand as an environmental performance review. And it noted that New Zealand's greenhouse gas emissions have increased by 23% since 1990. And Josh showed you that graph of what was likely to happen if we continued with business as usual. Well, essentially, we've been continuing with business as usual for the last last decade or two, despite the increasing evidence that we need to take urgent action. And we can't be complacent in New Zealand. Of the OECD countries, New Zealand emissions are the second highest level per GDP unit and the fifth highest per capita. Now, a lot of people say, well, New Zealand is we're just a small fish. What we do won't make much difference. It's much more important that the US takes action or China takes action. But we're one unit of what, 4.5 million people. But you could pick probably half a dozen states in the US who are the same size as us. And if each state said, no, we're not going to be involved, we're just small fish, what we do is not going to make any difference, then we will get no action. So we can't get away from our responsibilities just because we're a small country. Furthermore, we're actually contributing to the problem as health professionals. Josh has given you a lot of reasons why we as health professionals should be concerned, because climate change is affecting the health of individuals and societies. But there are no good estimates for the New Zealand healthcare system, but 10 years ago there was an estimate that the healthcare sector in the US was 16% of GDP, and that it was responsible for 8% of total US greenhouse emissions. That's a substantial amount. So we as healthcare workers are actually responsible for a lot of the greenhouse gas emissions. In New Zealand, healthcare is probably coming up to 10% of GDP. So it's not a big extrapolation from US data, and there's similar UK data to suggest that the healthcare system is actually contributing to global warming. How is that? Well, most of it is probably 2/3 of it is what's called procurement. So that is the greenhouse gas emissions that result from manufacturing pharmaceuticals, for instance, transporting them, the packaging of them, but also everything else we use in healthcare. It has to come from somewhere. It's not just what happens in hospitals. It's what happens to keep hospitals going and community services going, the commuting that staff do. It's all involved. It all contributes. So what should we do? Scott Metcalfe, who spoke to you this morning, was an author of a very good paper that I'd recommend to you that summarises the implications of climate change for New Zealand health, but also looks at the sorts of actions that that can be made, and it also stresses that a further reason that we have as health professionals to be concerned and to take action. We have the responsibility towards our patients and our society. We have the recognition that we are partly contributing to these problems, but also there are extra benefits, there are co-benefits of action on climate change. So not only will we change the underlying problems that climate change is causing, but as part of the solution, we're actually going to improve the health of our society by improving the amount of active transport which is taken, increasing physical activity of the population. We're going to improve health. We're going to reduce air pollution through fewer particulate emissions from cars and other vehicles. we're also going to help address equity. For instance, if we increase the funding of public transport, then that will have a disproportionate effect on the less well-off members of our society. If we look at our diet and try to change our diet so that that is associated with fewer emissions, then one of the things we'll do is reduce the amount of red meat we eat, and that has implications for health as well. If we improve the insulation of homes so that we're using less energy in order to heat our homes, then we're also going to reduce the illnesses that are associated with damp housing. And if we burn less fossil fuel, as well as reducing the amount of carbon dioxide we're emitting to the atmosphere, we'll also reduce the amount of other matter that goes into the atmosphere, and will reduce air pollution. So all these, this is just a few examples of the co-benefits of action on climate change. What sort of action can we do? One good example that has happened here in Christchurch is that the old coal-fired burner at Burwood Hospital has been replaced just last year by a new burner that uses biomass, wood chips, it's been calculated that the CDHB is emitting 6 tonnes less of CO2 than it would otherwise. Now, unfortunately, the Burwood Hospital is one of the smaller hospitals in Christchurch, and the campus that we're on at the moment has a much larger boiler, which is coal-fired, and there is an ongoing debate and about what should happen to that boiler, and as health professionals we are trying to influence that debate to change that so that our major boiler for the CDHB is biomass fueled rather than coal fueled. Another sort of intervention that is possible for health professionals is exemplified by the Zero Hero program, which was put together by our sustainability coordinator, James White. Sorry? James Young, who was employed by CDHB for several years. Unfortunately, he's no longer with us, 2 years. And Anna, who will talk next, was instrumental in having him appointed and was supervising his work. But one of the big things that he did was to produce this program, which was to encourage CDHB employees to reduce their the environmental impact of their work, also to think about how their activities at home influence the environment. This was, there were 5 major streams which were exemplified up there. I won't go through them all because I think most of the time is supposed to be the forum today. But as an example, here we have one of our staff members dressed as a superhero holding an energy efficient light bulb to encourage people to think about energy efficiency in their work. And this is actually a highly structured program. It starts off with very simple things that everybody can do, just making sure you switch off your computer at night, you switch off your lights. You look at changing the lights, make sure that in your department you're using energy efficient bulbs. But there are stages that departments can then look at and go into more detail. They can analyse their energy, produce an energy budget, look at how much the CO2 emissions associated with that are. And there are a whole lot of checklists that people can go through. And an important thing is that this is not just individuals as well. This is people working together in partnership in a department or a hospital ward. So it's a very collaborative thing. And so finally, I also was going to make a plug for OraTaiao. Go and look on just search on the web and you'll find it very easily. It's open to all health professionals and including medical students, and we do have quite a few student members. But there are other, and the aims of OraTaiao are education, educating the general public, advocacy, and promoting changes that will reduce our greenhouse gas emissions, particularly relating to health, but also thinking about the greenhouse gas emissions generally because of the general health effects. I was not aware of medical students for global awareness, but I found that as I was preparing on the website, I was just preparing for this talk, and so there are certainly many other groups that you can join to take part in advocacy and activism as a medical professional to try to improve things. So the other networks that include the Sustainable Health Sector National Network, which is a group of mainly DHB employees, but also some university people, I think, who meet together by teleconference once a month to share ideas and to discuss strategies. Individual workplaces and DHBs have their own grassroots groups. Here in Christchurch, we have Sustainable Health for Canterbury. The specialist colleges also, many of them have been doing work on climate change, such as the College of Physicians. Of course, it's also important that as health professionals we engage with other activist groups outside the health sector too, because we can bring special skills to them. And just as Josh mentioned earlier, how the focus of the TPPA debate didn't involve health because people didn't appreciate the health effects. In much the same way, we need to make sure that people in general are aware of the health implications of climate change. So those are my slides. I'll hand over to Anna.
Does anyone want to stand up?
Thanks very much for that.
Okay, let's get started.
Okay.
How do we turn this on?
I think it's on.
Okay, is everybody ready for us to get started again? I've had a horrible virus for coming up 12 weeks now, not that I'm counting. And my voice is pretty rubbish, so you will have to pay attention. I'm Anna Stevenson. I'm a public health physician, and it's difficult when you're putting a talk together when you don't know what other people are talking about. So I'm going to. I just had one slide here, which is really just to say that I agree with everything that I heard Josh say and that Iain said, and there's a really big problem, and the problem is caused by humans, and this is kind of the proof slide, I guess. But we won't go into detail about that one. The greenhouse gas effect leaves a fingerprint. It's our fingerprint. And so it's our problem to own or disown, really, as we want. And this is a slide that Alistair Woodward gave me. Alistair's a public health physician. He was one of the authors on one of the papers that you saw up there. He was a member of the International Panel for Climate Change, IPCC, and was one of the people who got the Nobel Prize for his work on that. So he knows a lot about this stuff. And you can see in that slide there, carbon emissions going up. This is the fingerprint of humanity on the world. You can see that even things like the Great Depression, the big oil crisis, things that made quite a significant effect on the world's GDP, didn't really make much of a hit on carbon emissions. There was an effect, but not a huge amount. And they're still climbing. And then on the blue, on the right side of the chart there for you, that's the cuts that are required for a 50% chance that we not exceed 2 degrees warming by the end of the century. And I find that slide quite confronting. You can see that the cuts required are radical, and that's just for a 50% chance of achieving that 2 degrees warming. And 2 degrees is just a number, right? We could say 3 degrees, we could say 1.5 degrees. 2 degrees is what's been chosen, I guess, by the IPCC. This is where things start to get out of our modelling. You know, we don't actually know what's going to happen. This is the tipping point moment. This is where things could start to get really scary, the zombie apocalypse kind of stuff. So 50% chance is going to require pretty significant action. And this morning, my 14-year-old son asked me what I was doing. I said, I'm heading off to do this talk about leadership, rah, rah. Got any thoughts that I should pass on to the medical students? He said, no, I'm not really convinced by any of this stuff. I said, what, you don't believe in climate change? He said, no, definitely, I do believe in climate change, but I don't really think that there's anything we can do about it. It's all over. And besides, it's not going to have any impact in my lifetime, he said. I'm just like, oh my goodness, I hope this is just a 14-year-old developmental stage thing. You know? There's nothing that I can do about it. And I said, tell me a bit more about that. He goes, well, obviously there are things that we can do, but it's going to take everybody to do it. And I just don't see that everybody is going to do it. So, c'est la vie. It's like, well, okay. And I think that is most people's response, actually. If they believe in this stuff, if the evidence is enough to convert them, a graph like this doesn't really make you feel encouraged that it's worth doing anything. So, let's eat, drink and party till the end, I suppose. So, so what does leadership take in a situation like that? And like Josh, I'm really impressed. I didn't know there was such a thing as the Medical Students Leadership Conference, and it's just fantastic to see you people here. I don't know how you get to be here. Do you decide you're a leader, or have you been chosen as leaders? I don't know, but it's amazing to see you in this room. And once you get into the whole leadership discussion stuff, there's that whole thing about everybody's a leader, right? We all have the ability to lead, to make changes in some sphere or another. And part of your role as leaders is to help other people uncover their leadership potential and to uncover their ability to make changes. So, who's a leader? And you've heard some of this stuff, what can you do? A key thing, Josh talked about being an advocate, and he described some of his own journey around that. Being a role model is a really critical part of what you can do, and it's important for everybody, but it is particularly important, I think, as Josh was describing and Iain was describing, as doctors, because for good or for bad, for whatever reason, doctors have got a position in society which gives us a voice, gives us a platform. We still have reasonable respect from our community, and when we say things, when we live our lives in a certain way, people do pay attention to that. So Iain talked about active transport and the co-benefits idea. He talked about going vegetarian, eating less meat. There's a lot of health co-benefits around that. This stuff isn't actually easy. When you start to take this really seriously, it's going to make quite significant changes to your lifestyle. So in New Zealand, we're really into this kind of house designer porn stuff. There's lots and lots of TV programs out there about this beautiful house, this biggest house, this best house. But if we really want to reduce our carbon emissions, we're going to have to build smaller. We're going to have to say we don't really need to have 300 metre square houses for 4-person families. And as I say that, I disown to my complete hypocrisy, that we're telling people to do things that we are all complicit in. So I can feel quite good about active transport. I do generally bike most places, but Tuesday, 6 of my family are heading off on a 24-hour plane trip to the other side of the world. The world that we live in makes it extremely difficult for us to be pure about this stuff. And that can also diminish our voice sometimes. And we need to think about how do we keep telling this story? How do we live a life that is as aligned with the evidence and with our values? But this is our real life. Sometimes we trade things off. Sometimes we have to say it's worth spending the carbon emissions here because I'm going to get this gain out of it. But for me, I offset all of my flights. I don't know how many of you flew here. For you to offset your flight from Auckland to here is about the cost of a coffee. I don't know. Have you done it? Do you know where to go to do it? You can find it on OraTaiao website. There's other places to do it. Has this conference gone zero carbon? There are lots of things that you could be doing that are not that hard, but they're not in your immediate consciousness. And you need to kind of, at this point in the progression of it, you need to almost make it like a diary item. Is it part of my conference organising checklist? What have we done about, is the food vegetarian for this conference? When I tried to I did organise a conference 2 years ago, and one of the things I specified was vegetarian food, and the general manager at the hospital here, who was responsible for paying the bills, overrode me on that one. And she said the topic of the conference was about something called health and all policies, which I'll talk about later. She said, look, everyone thinks you're completely nuts anyway. And if you have vegetarian food, they're going to know you're nuts. And that's brilliant, really, isn't it? It's, how crazy do we look when we say what the evidence tells us is the right thing to do? And as doctors, we know that eating a lot less meat is the right thing to do. And really, having a vegetarian meal at a one-day conference, is that so bad? Would people really even have noticed? Well, apparently they do. They notice that stuff. So, I'm hoping that the next time I do something like that, I will have made some progress and we might be able to go vegetarian. But this stuff costs, and you need to decide how much of a cost you're willing to pay and how much you're going to influence other people to do it. So being a role model is really, really important. But I don't really think it's enough. And so, like I just said, I work in the area of health and all policies, and someone up there made a comment, I don't think he's here now, about planetary health, about One Health, about, there's all these different things, and what are the parameters around them? And in my view, they're mostly the same. The Venn diagram, there's a really strong overlap. Health and all policies is very much is another one of these things, and it's about saying, in all of our policy making and all of the projects that we're doing, how do we say, what is the point of this? Ultimately, the point of it is about better quality of life for populations, for individuals. So how do we make sure that the policy that we're designing, the project that we're working in, the buildings that we build, how do we make sure that they are actually doing what they're intended to do? And we say you've got to work on all these different levels. You've got to work at the ecosystem level, at the natural environment, at the built environment, at the political environment. It's not just about individual life change stuff. It's not just about saying to people, when it comes to obesity, exercise more and eat less. It's about the food environments. You guys get a lot of teaching about this. I know we didn't get any when I was at your level. But it's like, what can you only get hot chips when you go to school, or are there other foods that are available to you? So this is a kind of map that I use in all of my work. And I put up this example here about tobacco consumption and cigarette prices, because this is an example of change that has happened at a population level and in our country. But the change has happened not because doctors and other individuals said, stop smoking, it's a really bad thing to do. That was a part of it. The big changes happened when we increased the price of tobacco, when we reduced advertising, when we made it harder to buy cigarettes, when we changed the rules, when we changed the social rules, the political rules, when we changed what was going on in international trade treaties, that's where the big changes happened. And although many more people still smoke than we want to smoke, you can see that really dramatic changes have happened in quite a relatively short space of time. So we need to work at all of those levels if we want to achieve change. I don't have a slide here, but it's rulechanges.org. I know a few of you are on Facebook up there, so maybe you could just slip over to rulechanges.org, and you'll find a really interesting website there about the environmental sustainability changes that are required and how you achieve that. And it's exactly this kind of concept. There's a 10-minute animated video there that talks about all the rules that you're not even aware of, that shape all your decisions, that shape the way you live, and what rules are going to be needed to change again. So that's my point, really. Us being role models is critical and it's important, but recycling is not enough. We need to recycle, but it's not enough. We need to make big changes, really big changes, if we're going to have any chance of doing this kind of stuff. And the thing is, we know that we do have a chance. We still have a chance. And we know that the Lancet just came out last year with that paper saying, actually, this is a really amazing opportunity. And there's some reframing that's required for all of us around how do we stay positive, how, like Josh said, how do we be a glass full person in the face of what can be pretty depressing stuff that's coming out all the time. This morning, clearly communication in my marriage isn't going that well at the moment, and apparently nobody knew that I was heading off today. So when I arrived here at the hospital, there was this flurry of texts from my husband, and he was saying, you got to tell him this, you got to tell him this. He's in private practice as an ophthalmologist, and he pointed me to a page on his website where he's got every single thing that he's doing in his practice to try to mitigate carbon emissions. And they range from walking to work to encouraging his patients, giving them bus passes to come to work, to supporting bike share programs in Christchurch, to recycling, to, you know, all of these things. They're all the basic stuff. But the great thing is that he's got it on his website, and he's out there saying, you know, this can be done. Imagine if every medical website in New Zealand had a page that was solely devoted to climate change and what are we doing about it. My husband is an ophthalmologist. He does microsurgery. He's as micro can be. But he can put that message out there, and that's part of being a role model as an individual and as a member of this profession. So finally, this is, I think, the most important part of my talk, of what I want to say to you. I talked earlier about how I feel a real hypocrite often when I'm talking about this stuff. And you know, this is certainly an area that I also feel a real hypocrite about. I'm almost 50. It's taken me a really long time to learn some pretty basic stuff. And I don't know, you know, you guys seem, like Josh was saying, you guys seem to be so much more evolved than I was, or, you know, at your age, so maybe you know this stuff already. The challenge of leadership that's described here is to be strong, but not to be rude. When you have an issue like climate change, which does feel like a bit of a burning platform sometimes, it's so important and it's so confronting. You know, you start getting all ardent and flag waving, and it can be, you just want to shake people sometimes. You know, how stupid can you be? Don't you know that, you know, what has to change? But that doesn't work. It's not kind. We need to be strong but not rude. We need to be kind but not weak. We need to be bold but not bullying. Thoughtful but not lazy. Humble but not timid. Proud but not arrogant. We need to have humour without being ridiculous about it. And this, even if you're not into climate change, if climate change is not your thing, this is what you need as you engage with patients. So as health professionals, the people, when you think about the doctors that you've engaged with when you've been in trouble, when you've had a health issue, when you've needed help from somebody, maybe not even in health, who are the people that have helped you to change, or that have helped you to be different? And it's not the people who yell at you. It's not the people who shake their fingers at you. It's not the people who swear at you in clinics. It's not the people who shame you. It's not the people who make you feel little and small. It's these kind of people. Strong, kind, bold, thoughtful, humble, proud, funny. And that, to me, is summed up about safety. We want people to change. People don't change until they feel safe. You don't change until you feel safe. You don't grow until you feel safe and nurtured and cared for. And that's what we're talking about when we're talking about equity for all of our populations, all of the people in our country. But people are not going to change their behaviours until they feel cared for, until they feel acknowledged and respected. So even if it's not about climate change, that's my big message to you as up-and-coming doctors. How do you, in all of your encounters, when you're really stressed, when you're really tired, when you've got so much going on, how do you, in your interactions with those individuals in front of you who are at their most vulnerable, how do you create safe places for them? And then when you're going out advocating about stuff like climate change, which is going to require very big changes, how do you do that in a way that is kind, that is humble? That's my presentation to you this morning. Thank you.
Thank you so much, Anna and Iain, for presenting climate change in such a compelling way and also providing us with some potential actions that we could take. I've just heard the news that Charles is actually on his way and he'll be here at 12:20, so we'll be just postponing lunch till 12:30 so that we have the opportunity to hear from him as well. But in the meantime, I'd like to invite both Anna and Iain to have a seat on the panel chairs, and we can take some questions from the audience. So, okay, yep.
Thank you both people. My question is specifically for Anna. So you talked about, well, first off, your son's a realist. Let me just say that. You talked about, making sort of change in behaviours, and I guess here we've talked a lot about, making change at the upstream factors like advocacy and policy, but we haven't really talked much about how we can actually influence people to, change their behaviour towards climate change. And obviously you sort of mentioned a bit about, creating a safe environment. I was just wondering whether, as future health professionals, is there something that we could, personally do in terms of consultations to sort of help that along? Because currently, in terms of smoking cessation, if anyone sort of comes in, we sort of they urge us to talk about smoking cessation with everyone. Is there something like that we can be doing? What's your take on it?
Nigel Miller was the Chief Medical Officer here until about a year ago, I think. Nigel used to say that if he had one pill that he could give to every 50-year-old male who came to him, it would be a bicycle. That getting them just trucking around town on their bikes would improve their hypertension, would improve, so many of their diseases. And I think active transport is a huge area that we could be advocating with our patients for. But of course, that's not just the individual that is going to require the cycleways, the change in car behaviour. We had I feel uncomfortable talking about this, but it has been in the papers all for the last week. Last week we had a doctor here who had sounds like a really bad accident on her way to work here, and she broke a few things, and it sounds really bad. But she was featured on the front page of the paper saying the District Health Board needs to provide a lot more car parks so that we can drive safely to work. And that's just the wrong thing to say, basically. And I have, like I say, it's really difficult to talk about. A lot of sympathy for her and her personal situation. But the District Health Board needs to provide safe ways for people to cycle, bus and walk here, and they need to do it now. And when they get here, they need to have good places to put their bike and all that kind of stuff, And that needs to be, we need to change the culture. So when my husband says to patients, I'll give you a bus pass to come to my rooms, the bus stop to his rooms is literally 50 metres from the front door. And people just, they laugh at him and they say, why would I ever take a bus to where you're going to? When I brought my son to the hospital here 10 years ago for a tonsillectomy, he was completely well. It was easier for me at the time to grab the bus at the end of my street, bus to almost the front door of the hospital and walk in with him. When people found out that I had bussed to the hospital with my son, I was like the world's worst mother. The culture is that we drive to hospital whether we're well or not. So that's one small thing, is you can push really hard on lots and lots of levels for active transport.
And I think also, thank you, creating the conversations and making sure that it becomes normal to think about the effects on the climate of your activities. And I'm so impressed to hear about Malcolm's website, because one of the difficult things is trying to find the opportunities to talk to people about this sort of thing, where it doesn't seem strained or artificial. And you don't end up sounding like a weirdo because you're like the conversation about vegetarian food, and it's not easy. But we've done that with smoking cessation now. It used to be felt to be intrusive and impolite to talk to people about their smoking. It was sort of something that maybe they shouldn't do, but that's their decision. We have to respect their choices and so on. But now it's the climate around smoking has changed so much, and we need to create the same sort of license for people to be open about the effects of their activities as we have about smoking.
What did Josh and Scott think?
I'm kind of thinking, I think it's a combination. I think there's two things that have to happen. I agree with Anna on the whole macro thing. But in my own personal experience, and partly because I've been kind of pushed, that's fine. I think it's a case of walking the talk and talking the walk. What I mean by that is there's nothing like, I guess, busing and doing active transport for you to get interested in advocating for better for cycle lanes, and all of a sudden you want to go to public meetings because it's going to affect you. If you're not doing those things, then there's incentive to advocate for things. And at the same time, a lot of my own kind of thinking has been, well, the first thing to do is actually take your own footprint, know what your own footprint, and in just last decade in the UK, they had a very good 10 by 10 campaign that was, getting everybody to aim to reduce their emissions by 10% for the next year, for the year 2010. So what that is rather than trying to fix it all, you're trying to just, first of all, know what your footprint is, and then start working at it slowly, but gradually, and keep on reducing. And the more you reduce, the more you have a chance to work out other ideas of reducing. So, and the more you talk about things and then you do things, so they actually take on, I guess, a positive feedback cycle. And that's what I would recommend. So don't try to do it all yourself. Don't try to do just one thing, not the other. And in terms of the whole ideas around, advocacy and the point, well, what was the point with Josh's campaign? Who knows? But what I know is that if it's like climate change mitigation, and it's the same kind of thing. Everybody's kind of got to do their bit. If nobody advocates, and it can be a lonely place, then nothing gets done. So it's just like that. Everybody's got their own place.
I agree with all the comments, and I just say that yes, these different approaches are supplementary. They both need to be done, and I think they both, as Scott so nicely put it, they reinforce one another, and we need to act individually. That's part of starting those conversations, I guess, and as well as sort of focus on changing the policies and things. But I think the extent to which each of us as individuals do those things is something for us to work out individually. The balance between those things according to what our interests and abilities and those sorts of things. But I think in terms of the personal activities, I mean, yeah, there's a lot we can do, and I think everyone can do that.
Thank you for all the responses to the questions. We've actually run out of time, but I'm sure the speakers are around afterwards, so be happy to answer your questions. And now it's my privilege to introduce Charles from 350.org, who might be able to provide a different perspective on this issue.
Thank you. I'll just get wired up. Well, that makes a lot of noise, doesn't it? Right. Okay, to start with, want to talk about the science. I give talks around the country on the latest science of climate change, and I thought that'd be a really good place to start. The science is now absolutely conclusive. The Earth is warming at an alarming rate. It followed the models that were set up in the 80s, the computer models, up until the end of 2015, and then it just took off. It went far, the heat rise went far faster than any of the models had ever predicted. So they're rising at an alarming rate. We measure the temperature of the Earth from pre-industrial levels, so usually the date is 1850. And so we measure the rises since 1850, because 1850, the temperature of the world was pretty much as it had been for the last almost 10,000 years, and been quite steady. So we reached 1 degree above the 1850 levels in 1992. We reached 1.3 degrees above just this last summer. The projection is 2 degrees by 2022, 3 degrees by 2055, 4 degrees above by 2070, and 5 degrees by 2090. So it's rising at a really rapid rate, and humans have never lived in a land in an Earth with 3 degrees temperature or above. So we only really have a few years to stop the runaway global warming because of the emerging feedback loops. Now, one of them is the ice melting at the poles. Well, the Arctic and the Antarctic temperature rise is double what it is for the average of the whole Earth. And so what that means is now the ice is not only melting from above, but the ocean temperature is rising so quickly that it's melting from below, both in Arctic and Antarctic. This is releasing a lot of cold water, not only from the Arctic and Antarctic, but from Greenland, northern Canada, Siberia, and it's starting to alter the ocean currents. And the ocean currents, particularly the Atlantic Ocean currents, are the ones that keep the east coast of the United States and all of Europe habitable. So that's one feedback loop, and that will just continue to get worse. A bigger feedback loop, and some scientists have called this an extinction event, is the methane that's melting in the Arctic, all above the Arctic Circle. Started out melting from the seabed, from the sea warming up, and whereas it's normal to have bubbles of methane coming up that are maybe a meter across, now we're getting them that are hundreds of meters across. And just lately, the latest study that I read was about the methane bubbles on land. So the thing is that tundra, which is what you get for most of the land area in the Arctic Circle, the tundra is melting. And tundra holds massive amounts of carbon dioxide and methane. Methane is 22 to 27 times more powerful as a greenhouse gas than CO2 is. So this methane is being released from the tundra. Thousands of apartment buildings in northern Siberia, in Russia, are falling apart because all the land that they've been built on is melting and they're sinking. And now we're getting methane bubbles coming out of the land. Now, this is a feedback loop that is uncontrollable because every little bit of extra warming melts a little bit more tundra. It warms up the sea, which also transfers heat onto the land. So it really is quite serious. The jet stream around the Arctic, which controls all the weather around the world, all the wind in particular, the patterns are altering quite dramatically. Scientists have never seen it before, and it's because of the warmth in the Arctic and the lack of coolness in the air. So the wind is created by a different temperature differential between the Earth and the sky, and those they're both warming, and you're not getting as much of a gradient in the temperature. And I mentioned the ocean currents and things like the El Nino we had going up until about April 2016. It affected us with droughts and storms and things. Those types of events are made worse by the rising temperature. So we've only got a few years to stop global warming, and basically that means no more coal or oil coming out of the earth at all. That's what we have to do if we want to slow this thing down and have some kind of a future for our kids. Okay, so let's switch on to then the climate change and the effects on health. The World Health Organization said that climate change affects the social and environmental determinants of health, like clean air, safe water, sufficient food, and secure shelter. By 2030, climate change is expected to cause more than 250,000 additional deaths each year from malnutrition, diseases, diarrhea, and heat stress, not to mention the injuries and deaths from severe weather events. According to the National Institute of Environmental Health in the United States, climate change will be a driver of disease migration, as well as exacerbate health effects resulting from the release of toxic air pollutants, particularly in vulnerable populations like the children, the elderly, those with asthma, and those with cardio disease. Climate change already has serious impacts on vector populations. Vectors are things that carry disease, like mosquitoes, ticks, black flies, triatomine bugs. In Vietnam, rising seawater levels, temperature increases in the land, and changes in rainfall, which are all as a result of climate change, they're expanding the areas that are conducive to these vectors. So just imagine, malaria-centered they say this far above and this far below the equator around the world, and it's doing this. And dengue fever, which was once confined in Vietnam to the southern Mekong Delta, which exits, I suppose, Vietnam, right at the bottom of Vietnam. It now appears in northern provinces the whole year round. So that's how much the warming has affected the vectors. According to the World Health Organization, after a natural calamity, the environment will suffer major disturbances like heavily contaminated water, which leads to intestinal and other diseases. They estimate that in 2000, this is the latest figures, 6% of malaria cases were as a result of climate change. A lack of safe water can compromise hygiene and increase the risk of diarrhea, which already kills 750,000 children under age 5 every year. Drought causes famine. Climate change is already increasing the frequency and the intensity of droughts right around the planet. Many countries are experiencing extreme drought right now. Heat waves, which appear more frequently and with higher intensity, increase the risk of thermal shock, stroke, heart attacks, and they increase morbidity and mortality amongst the poor, elderly, and children in particular. Changes in air quality because of climate change lead to colder temperatures in cold seasons, which contribute to chronic respiratory diseases and asthma. Already 26 million people are displaced by floods and storms every year, and as you know, the floods and the storms are getting more frequent and much more intense. And 21 million right now are in danger of dying because of droughts. Ancient diseases like anthrax are being released by the melting tundra, where they've been frozen. And some of them, when I say ancient diseases, we also have some more modern. I mean, the example that I read about describing this was a man who was buried in the tundra in a grave in the 1920s, and he had anthrax. And it melted around him. His grave was exposed. Those people who went to deal with him, I guess, or contracted anthrax. The U.S. Center for Disease Control and Prevention, the CDC, and I suggest to you get on their CDC site because they've got quite a few reports about the climate change and health. They list the following impacts on human health from climate change. Air pollution, which causes asthma and cardio disease. Changes in vector ecology, we were talking about malaria, dengue fever, encephalitis, hantavirus, Rift Valley fever, Lyme disease from the ticks, and West Nile virus. All of those are moving because the vectors are, or they're expanding because the vectors are expanding. Increasing allergens like respiratory allergies or asthma. Water and food supply impacts, malnutrition, diarrheal disease. Extreme heat, heat-related illnesses and death, cardio failure, and breathing difficulty from all the fires that are breaking out around the world. And we see this particularly in North America and in northern Russia. Fires that are exacerbated or maybe in some cases caused by climate change. Environmental degradation. So that includes forced migration. It's a really big issue. And I think it's an issue for New Zealand because you can imagine how many people, particularly in the Eastern Asia area around north and south of the equator, would find New Zealand a very good place to migrate to escape the heat. Civil conflict. Obviously going to have wars or maybe just local conflicts because of the reduced food security and difficulty of living, reduced water, and so on. And with the environmental degradation, you get a lot of mental health impacts. And then, of course, there's the severe weather, which we're already seeing. Injuries, fatalities from the weather, and, again, mental health impacts. So a couple of the CDC reports that you can download anytime. Extreme rainfall and drought can impact our health. Another one is warmer weather and flooding increase the risks of illness and injury. Another one is climate change decreases the quality of the air we breathe. Another one is extreme heat can impact our health in many ways. And another is climate change increases the risk of vector-borne diseases. So all of these are available. Just go into the CDC website. Medical and health issues because of climate change are already increasing rapidly. To participate in this growth industry, and it is a growth industry, medical students should consider the following areas of study, which are directly related to the health problems as a result of climate change. Respiratory diseases, cancer, cardio diseases, foodborne diseases, heat-related diseases, mental health and stress, neurological diseases, vector-borne and zoonotic diseases, weather-related morbidity, and human development effects. So all of those are things, well, most of them anyway, you can study right here at the Otago University Medical School and would prepare you for working in the environment of rising climate or rising temperatures. Now, things that you can do right now, besides, of course, reducing your own carbon footprint, ask your member of parliament what they are personally doing about climate change, and they'll fob you off. Ask them again. Go back next month. The following month, go back again. Ask them what they're personally doing. We have to put pressure because the current government we have here is subsidizing coal and oil and natural gas and not subsidizing renewables. So we have to put pressure on our politicians to change that. Get active. Come to our Climate 350 organize a lot of climate events. I've got a handout for you to take and a list of the Climate Week of Action we're doing where we have films. There's the March for Science, which you probably know about. We're organizing an MPs debate between the major parties on their climate policy. I'm lecturing on the latest science of climate change. Then on the 29th of April, we have the People's Climate Parade, which will be 1,500 to 2,000 people walking through. And then on the Monday, the 1st of May, Leonardo DiCaprio's brilliant film, Beyond the Flood, which we're showing at the Academy of Cinema for a fundraiser. Get on our mailing list, find out what we're doing, get active. All right. Join the Otago University's divestment group. So this is the group down in Dunedin that are putting pressure on Otago University to divest from or pull their investments back from any fossil fuel related things. And I don't know if you guys ever end up down in Dunedin, but join this group because they're doing great stuff. And I just noticed that only in the last several months that Auckland medical students have started their own divestment group. Could be something you could do here. Encourage the Canterbury District Health Board to switch from burning coal to renewable wood. They've got the boilers. The boilers can burn coal or wood. Just the feeder systems, they've only got a feeder system for coal, and they need to make the commitment to spend the money to get a feeder system for wood, and then they can eliminate coal, which is the worst pollutant of all. And complain to this hospital and to the District Health Board to stop running the emergency generators, which are just, I've lost my sense of direction, but I think they're just over there by the river, because they are running them to produce electricity to sell to Orion for a profit. These are emergency generators that if they break down, the hospital is going to be stuffed. They're running them sometimes 24 hours a day, particularly in the winter, just to make a profit. So that's something that you can do. Okay, that's all I wanted to talk about today, and I hope that I may possibly have inspired you to study some of the things, some of the disciplines related to health problems of the climate, because we're certainly going to need you. Thank you very much.
Okay, thank you very much, Charles, for that talk. I think there were some great synergies with what has been said before today as well. Yeah, I think now it's lunchtime, so I'll just hand over to Jenny to for that.
Yeah, so sorry for the delay. Outside. Regret to tell you that unfortunately it's not vegetarian, all of it, but we will work on that. Thank you so much to all our panelists. Thank you.
Well,